Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. And we have 3 sessions every day. And the first session of the day is already over in Hindi. And the second session will be at the international session from 8:30 to 9:30. And from 9:30, we have a local language session in Malayalam. All these sessions are going a good way. And we are uploading the videos of the session on the very next day itself so that you can subscribe it without paying a penny, as well as you can share it with your friends so that homeopathy will reach every corner of the world. And this is what the purpose of homeopathy. This is what the purpose of the International Forum for Promoting Homeopathy. That is to promote homeopathy, take homeopathy to every household. Thank you all. Let me come to the introduction of the faculty. As you know, today our guest is Dr. SUMANA KUMARI PANDA. She has completed the MD in homeopathy and is the retired district medical officer, Department of Homeopathy, Cuttack Circle, Cuttack Health and Family Welfare, Government of Odisha. She is a consultant at Dhabaleshwar Homeo Clinic, Cuttack, Odisha. And she has more than 35 years of clinical experience as well as teaching experience of 18 years in the Department of Veterinary Medica at Dr. Abin Chandra Homeopathic Medical College Hospital, Bhubaneswar. She is also a research personality, worked as a principal investigator and collaborator research project on CCRH, Government of India, efficacy of homeopathic therapy on duration of labor. She is a resource person at various training camps, as well as she has done so many awareness classes and programs for homeopathic medical officers in the community organized by CCRH, New Delhi, Health and Family Welfare Department, Government of India. She has presented various papers in the scientific presentation and national as well as international field in Liga, IF, is Research Society of India, like that. And she has published so many articles in peer-reviewed journals like IJRH, PUB, etc. She has awarded the best homeopath of Odisha by Hanumanian Palliative Sammelan in 2040 by Homeopathic Board of Odisha. She has won the best homeopath award from COVID barrier by Marawadi Mahila Samaj and Women Inspirator by Lions Club. Best Woman Social Worker by Odisha Nari Seva Sankar Kattak, and served as through Lions Club International as diabetic chairperson to create diabetes awareness throughout Odisha and received the most prestigious international presidential award in 2018. And she has done so many presentations in our forum. And today, Dr. SUMANA KUMARI PANDA will be discussing about the clinical application. Has done a beautiful presentation day before yesterday on the same subject, and let us see the remaining part of the same with some case presentation. We proudly welcome the guest of the day, Dr. SUMANA KUMARI PANDA. Yes, madam.
Thank you, Dr. Dhanesh. Namaste, sabko pranam. At the outset, I am very much grateful to the organizers of IFPH and very much grateful to my teacher, Dr. M.K. Shahniji, and my friend, Dr. Dhanesh, Dr. Manoj, and all other participants. I am very much grateful to you all. Really, as Dr. Dhanesh told, day before yesterday, I have completed the clinical application of phosphorus part 1 in a mathematical part. Usually I have finished, and I have gone through 2 cases. Today we will discuss the mental generals along with some cases. So let me share my screen. It's not coming.
Yes, it's open. already the wheat.
Okay.
Okay.
Can you, is it visible to you, the PPT?
Yes. Clinical application PHOSPHORUS.
Okay. Okay, thank you. So already we have finished about the mathematical part and 2 cases. Today I will present 2 acute cases and 3 chronic cases along with the mental features. So coming to the third case, my third case, this is a very acute case. Mucus polyp inside the mouth. So the girl of 8 years, she was a girl of 8 years. She came to my clinics having a mucus polyp inside her mouth. You can see this is the picture when she came to me. This is the picture, and this is the closed picture. And when she came to me, this is the picture. After 2-3 days, 3-4 days, this was the picture, and the features were that was the non-tender mucus polyp inside mouth, and that was the bleeding on list injury. Why that happened? Really, she had that mucus polyp for last 1 week only. So how that was started before going to through the case taking. When I interacted with her, I made friendship with her. And then that took me about 15-20 minutes. She was so friendly. She talked with me about her class, about her teacher, like that. So sociable, very communicative. So what happened one day, she was not, she couldn't answer. So inside the class, that's why the teacher was very unhappy with her, and she rebuked her. The teacher rebuked her. After that, she developed a fear and the anxiety again. Next day, she feared to go to the school on that day because the teacher may rebuke her, may beat her like that. So with these elements from, I focused upon this. So that was happened. After that, within 1 week, she developed this mucus polyp inside the mouth. And after 1 week at 10 days like that, she came to me. And the girl was very nervous also at that time when she came to me. She was also having that fear. She has gone to the school. Still then, she developed that fear because she was going with force. She was not interested to go to the school at that time. So the girl was very thin, fair complexion, and she, by asking some questions to the parents, they told that the girl is very sensitive to noise. She fears if any loudspeaker, to fears any mic like that. So she is very sensitive to that and to strong odors also. So basing upon this, I went for a short reporterization, and I went for again phosphorus 30 in diluted doses, 1 teaspoonful twice daily. And that was for 4 days. Again, after 4-5 days only, this was the first picture. Next is this, the redness and the swelling little bit reduced. Third is, this is the third picture after 15 days. There is no mucus polyp. Within 15 days that vanished. Phosphorus 30 was followed by phosphorus 200. Fractional dose once daily. And after 1 month, the patient left me and I also left her because there was no mucus polyp. Case was cured within 15-20 days, like that. So from this we can say that the phosphorus child is very expressive, very sociable, very communicative, but elements from we can get anxiety with fear, great anxiety with fear psychosis. We will get just like arsenic, we will get that, but arsenic patient child is not so communicative like phosphorus patient. So not so sociable. Phosphorus attracts your attention. If you will not give attention to him, she will try her best in which ways he can get the attention. That also we will find to some extent in arsenic, but not like phosphorus. Phosphorus leads in that sphere, and arsenic is child is very fastidious. Even if a small child, she is very fastidious, not but phosphorus is not like that. Okay. So, so that in that way we can differentiate the anxiety with the fear of arsenic with the phosphorus. And next case I will go through a case of viral hepatitis. So this is the case a viral. This is also a acute case, viral hepatitis A. The case came to me within 10-15 days of suffering. When the child came to me, he had a sore, tender abdomen and complete loss of appetite. Really, this is a case of 2014, I think. Yes, 14. So sore, tender abdomen, loss of appetite was there, and with a great weakness. Weakness was due to loss of appetite, and the child had vomiting, bilious vomiting, and which was aggravated 1 hour after food, 50 minutes, 1 hour like that after food, and relieved by cold water, drinking cold water. This is a case when the child came to me, this symptom was not there. Gradually that's developed. The was there, but the parents have not observed. I told him they came to me due to the soreness, loss of appetite, and severe vomiting, bilious vomiting. With much difficulty, with much pampering, the child took some food, but immediately 15 minutes, 1 hour after that was vomited out along with bile. So the parents were much more worried, and the child was becoming much weak day by day. Up to 15 days, really, the child was from a very remote village. They had gone for some local treatment like that, jhada funka like that. They had gone. So, uh, but the child was becoming more worse day by day. So in that condition, I told him give him some warm drinks and give him some cold water. So what happens? Tell me after 2 days. I gave him for that. Really, I had in the beginning, I had gone for chelidonium 30. But after 2 days, the soreness of the abdomen reduced to some extent, but other symptoms were as before. Nothing changed. And they told me that the vomiting was little bit reduced after taking cold water, but aggravated after taking warm water. So I finalized my drug with that. Chelidonium vomiting aggravated by warm drinks, and arsenic relieved by chelidonium relieved by warm drinks, arsenic relieved by warm drinks, but phosphorus relieved by cold drinks, and arsenic again immediately after drinking. But here what happens? 50 minutes, 1 hour after. So that might be in bryonia, that might be in phosphorus, when the water becomes, or the food becomes warm inside the stomach, the textbook writes. So basing upon that symptom, I went for phosphorus, and again the child has increased thirst for cold water, but at short intervals, just like arsenic, and desire for cold food. This will we find in arsenic and phosphorus both, and anxiety with fear, and during pain much more anxiety. The child was very restless and with much anxiety. But when the pain was not there, the child was very sociable and expressive, very friendly. So taking these symptoms, I had a very confusion within the arsenic and phosphorus. But then I went for the acute case taking at that time. And the case taking I had written in my record. really, I am reading all those things that I have taken pain, abdomen pain, soreness, and stomach appetite loss, loss of appetite, general weakness, acute disease, and proportion out of proportion. So he was very weak, and I had taken abdomen pain, hypochondria, generals cold taking tendency to, and in generals food and drinks cold food desire. So with this, the stomach vomiting, bile and vomiting warm food I had taken, and stomach thirst, cold water, short intervals. So with this, the phosphorus, I had taken 12 points, and we 12 rubrics, and the marks got phosphorus got covered 10 rubrics out of that and got 24 marks. Arsenic also covered 10 rubrics and got 22 marks. So basing upon this, I had gone for phosphorus. Phosphorus millesimal scale 0 by 1, 0 by 2, 0 by 3 once daily. I went for that, and the patient was able to purchase millesimal scale, and at that time also in millesimal scale was available in my clinic. That's why I went for that. Patient was cured within 20 days. So I can show you the report. So this is the first report, 2012, 31st March 2012 case. So this is the LFT report. You can mark that SGOT was 515. The normal value in male up to 40. Okay. And the male child had Om Prakash Behra. He had SGOT 515 and SGPT normal value is up to 41 and he had 371. The alkaline phosphatase also increased. That was the normal is 252, 770 and he had 834. Again, the serum bilirubin value was 2.1, so indicating quite jaundice, and serum bilirubin or direct 1.2. His urine was also yellowish, and he has jaundice symptoms with that. So this was the report of 31st March 2012, and next report after treatment he brought me on 9th April 2012. Within 9 days, after 9 days, this was the report. Serum bilirubin was 1.3. This was also more at that time. Here, serum bilirubin total was 2.1. And here 2.1 reduced to 1.3, serum bilirubin total 1.3, and direct bilirubin, serum direct bilirubin direct was 1.2, that reduced to 0.6, and SGOT from 515 reduced to 110 within 9 days, and 51, sorry, SGOT some 510 to 51, Om Prakash Behra, and SGPT from 371 that reduced to 110. Again, alkaline phosphatase also reduced to 774. The drug continued for 1 month and the patient was cured, and he has visited me after 1 month once. After that, he has not visited me. He was completely cured by that time. So this is the mental picture. We know that the we find in main feeling of phosphorus is unloved, uncared, great anxiety, feeling of helplessness is there. Seeking assurance. In anxiety is much more with arsenic and much more with phosphorus. But if they get some assurance from the doctor that yes, you will be cured. No, don't worry. You will be cured immediately. Don't worry. So with this only the phosphorus gets relief. But arsenic will not be relieved with this. The assurance can't relieve arsenic, but assurance can relieve phosphorus. From this also, we can think that this might be phosphorus. But arsenic is very fastidious, as I told you, and very industrious. Phosphorus is not like that. Both are intelligent. Arsenic is greedy. Both are very anxious. Phosphorus is not so greedy. And enjoys being hugged, kissed, rubbed. So all these things, very, very friendly, very sympathetic, draws very impressionable children and very sympathetic we find in phosphorus. Causticum is also a very good drug in sympathetic, leads the list in our Mathematica. Nitric acid is also very sympathetic. But in causticum and nitric acid, if you will go further counseling, then you can find that there is some reason behind it to be sympathetic, for some selfishness feeling behind it. But in phosphorus, it is nothing, no selfishness. You will find in case of phosphorus, pure sympathy, and very nervous, very apprehensive, responsive, sensitive. So we find in case of phosphorus, very cheerful, very optimistic. All these things which friendly, impressionable, all these things we find in the soric phosphorus. In first stage of, as Dr. Vitulkas has written, in first stage of phosphorus, you will find all these things. When in this stage also in pathology, you will find the gastroduodenitis, antral gastritis, a little bit bleeding, occasional epistaxis, occasional menorrhagia, like that. But whenever the patient, suppose ill-treated, the patient again went to second stage of phosphorus, anxiety is becoming much more at that time. And apprehension, all these things develop during that time. Okay, so very much apprehensive, very much apprehensive. Fear, elements from excitement, elements from fear and anxiety, elements of things that very becomes things that the disease may not be cured. But even if in this stage patient desires to be magnetized, in this stage assurance, okay, so if the patient is not completely cured in this stage even, then he went to the third stage. In third stage we find the anxiety is much more, too much, too much, and that tends towards, if the patient is not getting that much love, that much assurance in that stage, so in that stage, the patient becomes very hopeless, despair of recovery, and we say hypochondriac. Thinks that he might be suffering from gastritis, but thinks that I am suffering from cancer stomach. I am suffering from cancer duodenum. So like that, the disease, the mental pathology grows. And finally, in fourth stage, the patient becomes, when the soric phosphorus becomes a syphilitic phosphorus, in that stage what happens, the patient becomes taciturnously apathetic, indifferent to everything. I will discuss a case also in fourth stage of phosphorus, how he is getting relief, is managed, well managed in that stage. So because in that stage it is very difficult to cure, uh, might be cured, but very difficult. So in that stage, the patient syphilitic stage, patient becomes very indifferent to everything, to love, to every pleasurable events, to family members, to everything. And indifferent, taciturn, doesn't want to speak, and very despondent, despair of recovery. So he gives up everything. He gives up everything. Okay. So in that stage, and in that stage, definitely the gastritis symptom which was there, now it becomes cancerous condition. Now it becomes cancerous condition and it becomes very difficult to cure that case. I will discuss a case in this regard of idiopathic thrombocytopenia, how the mental picture changed and the pathology changed, we will discuss now. So in the, what I had discussed, they are deficient in ideas, weak memory, indolence, dullness, and very sensitive to all emotions. Ailments from grief, first grade drug, we will find just like natramur, staphysagra, ignacia, oromate, pulsatilla. So also we find lachesis. So also we find phosphorus. Ailments from grief, a first grade drug, in Kent's Mathematica. So fear of disease, death, thunderstorm, fear of thunderstorm, being alone, all these things we find in case of phosphorus mental picture. And anxiety already I had discussed, anxiety from pain, anxiety from with fear, sleep during, and the benevolent, communicative. Phosphorus is artist, creative activities we will find there, and very intelligent also. But artistic activities, creative activities we will find more in phosphorus, more in phosphorus. Just like in lycopodium also, they are very intelligent. Sulfur, lachesis, they are also very intelligent. Arsenic is intelligent, but more industrious. Concentration very difficult, very sensitive to criticism, fears, and rejection. These mental symptoms uh, may be reflected in stomach symptoms, maybe in palpitation, maybe anxiety symptoms, headache, causes headache. So mental symptoms are very, very important for selection of phosphorus. So value of love already emotion. Natramur thinks that love is a beautiful gift and unattainable ideal. So if you will love him, so he wants love. He wants love. Of course, Antim crude love seeks. Still then we find Natramur also wants love. And phosphorus thinks love is very exciting and very enjoyable. Pulsatilla thinks that love is the blessings from nature and quite essential. But for Sepia, love is a responsibility or even burden. That's why the children, she thinks that the children are burden to her. She has love inside, but manifestation of love is benumbed. She has no time, no energy to manifest love. That's why she thinks that it is a burden to her. And sulfur and lycopodium think that love is the human inherent due. I should get the love of my parents. Why not? Why they will not give love to me? She will demand sulfur and lycopodium. So we can differentiate in this manner also. Next case, we will go for another idiopathic thrombocytopenia. After that, we will go to these two cases. So this is the case of idiopathic thrombocytopenia with a brain tumor. This is a very, very interesting case really. In 14th August 2018, the case came to me and the patient presented with post-nasal bleeding, epistaxis, dark blood continuing for last 4 years, aggravation in morning, and a very anemic. Epistaxis relieved a headache during. So we had a drug, melilotos, like that. During, if the headache is there, he was suffering from chronic headache. Really, migraine was there associated with that. And so headache during epistaxis was relieved headache during. And headache associated with blood vision, that might be due to great weakness. When the patient presented me, he was unable to walk. Really, he was I must say the history. History is very important in this case. He was a person of tall, thin, fair complexion. Really, while I had spoken this case, of course, hurriedly in Hindi session, and in that session, the patient was present also. But I had no time to talk with him. So he is a very lean, fair complexion, tall personality, and he is of 50 years of age at that time when he approached me, and he was working in defense. He was a very intelligent person in an officerial rank and a very sociable, very communicable, very responsible officer in their department. But so all on a sudden, he had bleeding hematemesis. After that, followed by continuous epistaxis. And his hemoglobin at that time came to 5, 6 like that. And he was unable to work, unable to talk, unable to work. Even he was admitted in AFMC hospital, Delhi. And in during that period he was managed, but the suck period was there and that was managed, but the bleeding didn't reduce. Bleeding continued, epistaxis, post nasal bleeding continued after that. And again he was shifted to AIMS Delhi. At that time also the patient was not relieved, and finally he has to leave his job, he has to left the job. So that was a very embarrassing situation for him, that how to lead his family. He became financially very much downtrodden, and what he has to leave the job. After that he was a great grief condition came to his mind, and finally uh, he was shifted to Odisha, to his motherland, and to his village. And after that, again, his elder brother, he went to AIMS Bhubaneswar, and from that, there also there was no cure. So subsequently, he came to me, to our OPD. In the beginning, he came to our OPD in Abhinchandra when I was in Abhinchandra, and subsequently he shifted to my clinics when I left Abhinchandra. So, so in, the treatment was continuing. This is the history. Really, he had a hemicrania, aggravation, empty stomach, aggravation from noise, cold hair, like that. So with this, the temporarily he had impaired vision, might be due to great weakness, because two persons holding him in his shoulders brought him to me, and the patient was not ready to answer me anything. I gone through all the reports. He told me, no, nothing will happen. So, is there any cure? And I marked a great anxiety in his face, whether he can be cured with or not. But he told me, no, I am very hopeless. So big hospitals returned me. I returned from so big hospitals. So what will happen with this homeopathy? But still, then I have a little hope that the homeopathy may do something. So he told me like this. Again, he had the symptoms of bleeding gums, spongy gums, offensive mouth, and to some extent lumbago, aggravation in morning, rising after, and great prostration. That was remarkable. Remarkable prostration was there in that case. And the patient, already I had discussed all these things: desire for fried food, thirst reduced, indifferent to everything, no amusement, doesn't want to talk with the family members, to his wife, to his children, and doesn't want to talk to me also. So talk indisposed to during pain, and when he had pain, when he was suffering, he doesn't want to say anything to anybody. So basing upon these symptoms, anxiety was too much with during pain, and very hopeless, very hopeless. The case was very hopeless, and that cachectic loop. Okay, so with this, I had gone through the case, and this was the CBC report. For astonishingly, you will find the platelet count. Platelet count was 10,000. 10,000. Normal platelet count, we know that 1.5 lakhs to 2.5 lakhs, but it was 10,000. Okay. So everyone in my hospital, these PG students came and the internees came and they told me that, Madam, how the patient survives and will it be cured? So many questions were there on that day. So platelet count was 10,000 and I had gone through the case. In past history, he had epilepsy, splenomegaly, scabies, and bleeding. Bleeding was there, but that was neglected. And he used to take some allopathic drugs that was cured with that, and he continues his daily work with that. His parents had in family history cancer was there, and hemoglobin, but when he came to me, hemoglobin rate was 13.9. But I found a great weakness, and platelet count was 10,000. I gave him Sikelicar 31 dose, basing upon the bleeding was dark blood and offensiveness was there, and 2 ounce fractional, 1 teaspoonful twice daily, and carcinosin 200 once in a week as an intercurrent. I had gone through, started the treatment with this. So, so next visit, the patient brought me platelet count 20,000. And but these symptoms, epistaxis was reduced, but postnatal bleeding as before, headache as before, and weakness as before, and the headache was too much at that time with blood vision, and postnatal bleeding continued. Headache was so severe that basing upon that I had not gone through the reportization till date because patient was not saying me anything. So with observation again I went for drowsiness, and he has to take regular analgesic tablets. Headache aggravated from mental excitement, from heat. I went from gelsemium 1M and same carcinosin 200 once in a week as an intercurrent. Headache improved next visit, but bleeding as before. Gelsemium 1M again repeated, but bleeding was as before. But after analysis, I took these symptoms and mental symptoms. But by that time, I found the patient was not so cooperative. But the attendants, his brother came to me, and I found some symptoms from his brother, from his family members, from his wife, like that. So after analysis, because his home village was 200 kilometers away from our hospital. So the analysis symptoms taken, hemorrhagic diathesis was there, tubercular myasthoma is took, elements from grief, anxiety with fear. So a major grief was there in his office, in his office. He was humiliated due to no cause by the officers, and that was the fear with anxiety, great grief which was running through him for 1 to 2 years, like that. So after that, the bleeding was aggravated, and talk indisposed to, indifferent to everything, uh, perfectionist, consolation doesn't like, desires to be alone, dress sense was too good, restless and quite depressed. But history, when I gone through the history, I told you he was very friendly, affectionate, and very sympathetic. So basing upon this, I gone through the reportization, and I in a radar software in our hospital only I went through. So with that, I have taken the rubrics like mind anxiety, mind hopeless, mind indifference, everything to mind prostration of mind, and taciturn, head pain, cold aggravation, and the left side pain sides left, pain sides noise aggravation, face cachectic face, nose epistaxis, posterior part, and mouth bleeding gums. So like this, I have general thrombocytopenia, idiopathic thrombocytopenia, which was detected, diagnosed, and general weakness, loss of blood. So with this, I found I have taken 15 rubrics, of course, too much. But out of that, phosphorus covered 9 rubrics, calcarea 9 rubrics, nitric acid 9 rubrics, and graphite is 9 rubrics. But highest mark, phosphorus got 23 marks, calcarea got 18 marks, nitric acid got 18 marks, and graphite is got 15 marks. So with this, I went for phosphorus. Phosphorus 30 in diluted doses, I went because of course in this case phosphorus 01 might have been given, but at that time I thought this is the gross pathological changes is there, so I must go with the lower potency in decimal scale and in fractional doses. So basing upon that, I went in the diluted doses, 1 teaspoonful twice daily, followed by phosphorus after 4 days, phosphorus 200 1 teaspoonful twice daily, and phosphorus 1 m, along with carcinosin 200 or 1 m intercurrent I had gone through. So these are the case as a whole. I can show you the investigation reports. Here also we find platelet count 18,000, 15,000. Sorry, 15,000. Next, in July 2019, I told you that I had severe epistaxis and severe epistaxis. I remember a bucket full of blood was there. So he was admitted again to AIMS in casualty, and he was managed there. And at that time, they've gone through the MRI report, and the MRI brain report showed that the tumor is inside the brain. Okay. So again, I continued. He had hematemesis, melena also, along with epistaxis. The hematemesis was bucket full of blood, along with melena. So prostration was triple plus, you can say. So that was managed in emergency during that period. So after that, again I continued with phosphorus 1 m, carcinosin 1 m, and calcarea fluor 6 I added. Intercurrent carcinosin 1 m once in 15 days. So again in 10th 2019, headache left-sided aggravation shown, no epistaxis from last September 2019. So after 1 year of treatment with phosphorus 1 m, the epistaxis was not there, but headache was too severe with left-sided sciatica, aggravation from motion like that. And I went from natramur 1 m, basing upon that, because in loop T skipper, if you will read in the constitution of natramur, we find the layer remedy as phosphorus. And in phosphorus constitution also we may find at times natramur is indicated. So basing upon that text here ready, left-sided headache, aggravation from son, aggravation from anger, I went through natramur 1. And left-sided sciatica was there also with SOS if necessary, Colossians 200 BD if applicable. So severe pain was there in that case. So I continued with this second carcinosin 1 m intercurrent. So again January 20, after 3 months, the patient came to me. No epistaxis, no headache, able to read clearly, occasional sciatica. By 2020, he was very much cooperative to me. To some extent, not very much, to some extent, became cooperative to me, and he answered gently. So I continued with the phosphorus 1 m, continued. After that, from really from 2013, I am continuing phosphorus 10 m in 100 ml diluted doses once in a week, 1 teaspoonful once in a week, and carcinosin 1 m once in 30 days. and he is very cooperative now. From 2022 onwards, I am marking that he is very friendly. He is coming humorous with me, so humorous talks with me, and sometimes he says that he asks me whether I am in good condition or not. So he is very sociable now. Continuing phosphorus 10 in 100 ml diluted doses, one dose diluted and once in 8 days, 1 teaspoonful in 8 days interval along with calcarea fluor 6x. So the patient is continuing with this. Now also the platelet count is 10,000, but he is very, from 2021 onwards, he is very healthy, continuing his marketing, he is doing his gardening, he is doing marketing, he can move alone 200 kilometers by bus, he is coming by bus to me and alone. So very much normal. One can't say that he is diseased, he is sick. One can never say like that. So he is quite healthy, leading a very quite healthy lifestyle, but the platelet count is 10,000. And the brain tumor also you will find the size reduced. I had gone through, this is the 29th June 2020 report, and the size really, it is not the what she gave me, the scanning report is not very clear, but the size reduced. When I went through, this size reduced. I can show you the next report. Everywhere the platelet count is 10,000. In between, he developed again the hypothyroidism. TSH level was 12.34. I advised him to go for meditation, to go for regular exercise. So now that is also reduced. He is doing regular exercise, walking of 3-4 kilometers like that. So patient is quite well for last 5 years, you can say, leading a relatively healthy life, able to do all type of works, all type of household works. So this is the case of idiopathic thrombocytopenia. Next, another 2-3 cases I have, but I will go through only one case within 5 minutes. After that, we will go for question answer session. So this is the case, a very interesting case really. This is again a case of VSD, really ventricular septal defect, a 1-year baby with left to right shunt. So in this case, tachycardia was there, pulse was 102 to 106 per minute regular. And dyspnea was there, rattling chest, aggravation from cold air and evening, recurrent cold attacks, thick greenish nasal catarrh, cough, aggravation evening, night. Very cooperative baby. So as it is a very 1-year baby, and family history I went through, it was a tuberculosis was there, depressive psychosis with his father, with his mother-in-law, and even if with her mother, I can say, too much apprehensive. His mother was. Mother was too apprehensive. Today also I have given phosphorus in diluted doses to that child for cold attack. Today only I have seen that case. So anxiety with fear, double plus, affectionate, quarrelsome, discontentment in family atmosphere. I took the history of the mother. So basing upon this, I went for reporterization and I went up with the phosphorus 30, phosphorus 200 with tuberculinum as an intercurrent remedy. So now also I am continuing with the phosphorus 200, but alternate morning. Now it has become 1 teaspoonful diluted doses, 1 teaspoonful in alternate morning. So this is the report you can find, that this is the report of 14th February 2024, this year only. You can find here the the report was SCSD and 2.3 millimeter SAVSD with left to right shunt. This is in February report, and this is the report made in August 20th August 2024, this year only, SUSD VST is almost closed. VST is almost closed, and membranous septal aneurysm 4 millimeter. This happens. I talked with the cardiologist. They told that when madam the VST closes, the skin becomes like shrink. That septum becomes shrinkage. So that will automatically vanish. Don't worry. So the VST almost closed after 6 months of treatment with phosphorus. Can I go for in 2 minutes, Dr. Dhanesh, another case?
If you want, we can have another session on.
On just 2 minutes.
Okay.
So this is, I will not go through detail in this. So this is a case of multiple duodenal ulcer with severe burning pain in stomach. Severe burning pain. Still I remember the patient was means in gidgidaya tha. He was like anything. Pain was like anything. Aggravation empty stomach, relieved eating after, relieved after cold food and drinks. So elements from grief was there, apprehensive, and with a phosphorus 30, next 200, next 1M, next 10M. I went through this and the case was cured with this. This report you can find the 6th September 2002 and having the pre-pyloric ulcer, multiple duodenal punctate ulcers in GI endoscopy report. And in this, and after you can find this report in the 2000 May 2000, no, August 5th August 2005. So this is the report in 2002. After 3 years, the next endoscopy report was gastroduodenitis. So this happens also, very severe case. This was the multiple duodenal punctate ulcers and with severe pain. So these cases are very embarrassing conditions in this situation. Phosphorus helps in these conditions also, and the case was completely cured after that. But this idiopathic thrombocytopenia, no bleeding for last 5 years, leading a very healthy life, and the brain tumor reduced. And now also I am continuing with phosphorus 10M. So thank you everyone for patient hearing.
Thank you, Dr. SUMANA KUMARI PANDA, madam, for an excellent presentation on phosphorus as one of the biggest polycrust that works at all time, at every time, and whatever be the disease, it works. That's what you have shown in all these cases. The cases shown here are so brilliant, and definitely these kind of presentations will take homeopathy to higher level. And it's the time for discussion, only few minutes remaining. I just invite those who want to say, ask the questions or want to say something more. I want to add something more. You can raise your hand so that we will allow you to speak in short time. Also, the session, I invite Dr. Hariharan sir to begin the session. Yes, Ram Prakash sir. Yes. Yes, you can begin the session, Dr. Ram Prakash sir.
Okay, doctor, good evening. Good evening. Good evening. Really, I am congratulating you. See,
Thank you.
I liked your presentation. I liked your brilliance. Everything I liked. Such a beautiful presentation and beautiful case taking. Everything is all right. And particularly, I liked your administration of medicine. That potency is really, that is very good. And that tandem potency, phosphorus tandem potency you gave in, see, I think 100 ml of water, and then you gave as very little, 1 spoonful of tandem. That is very good.
In 1 week, once in a week.
Once in a week, that is very good. One dose is divided by, see, so much of pieces, and you gave one piece to the patient.
Yes, 100 ml. 100 ml continues for 6 months, like that.
See, that is your administration of medicine. That is very, very, very fine. Okay, doctor. See, you come again to our this forum and see enrich us with your knowledge.
Thank you, sir. Thank you. It is your highness.
Thank you.
Thank you, madam. Thank you, madam.
Thank you, sir. And it's out to another person, Dr. Ram Prasad, sir.
Thank you, Dr. Dhaneji, and Pranam, Dr. Harian sir, everyone, namaskar, and congratulations, Dr. Madam.
Okay,
Very
thank
nice
you, thank you, thank you.
Evidence-based presentation. Case number 7, the very good beauty of homeopathy. Presentation, intercurrent remedy, carcinosin, and brain tumor, and cure the patient according to elements, anxiety, grief, and the main cause of disease, invisible. Grief, anxiety, fear, select remedy,
No, phosphorus
cure the
change his
patient.
mental picture also.
Mental picture also.
Completely
Intercurrent remedy. Carcinosin is a very good remedy. Sympathy, etc. So very, very thanks. Every presentation, beauty of homeopathy. So thank you, madam. Very, very thanks.
Yes.
Thank you, sir.
Yes, thank you once again, Dr. Ram Prasad, sir. As you all know that Dr. SUMANA KUMARI PANDA was a district a medical officer, Department of Homeopathy at Odisha, and she has an experience of 32 years in clinical science.
Really, Dr. Dhanesh, one question came in brain tumor. I have not gone through the follow-up remedy. Really, I have gone through. Phosphorus is for the idiopathic thrombocytopenia. Idiopathic is for the brain tumor. Idiopathic is for that patient only. So, and in my document, you will find his telephone number also. So,
Yes.
phosphorus is the constitutional remedy for him. Whatever may be the pathology, whatever may be the nosological diagnosis. So, in brain tumor also, I have followed up with this. The headache was there and it is not there now. And no epistaxis, no bleeding, no complaints now. So I have gone through the follow complete. If you doctor, if you find write me, I will individually send you the copy.
Yes,
Madam, suppression of headache, suppression of sciatica.
Hello.
According to brain tumor.
Yes.
Suppression of headache and sciatica.
Now also the treatment is continuing on. It is not stopped.
Okay, now
Thank you.
it is the time to wind up the session. I invite Dr. Harihan sir to say a vote of thanks to the session. Please unmute, sir. Please unmute.
Hello,
Nice.
hello,
Hi.
respected madam. Really, I am proud to say, for all the participants and for the on behalf of listeners and all, I am really saying thankful to you. Please come again. Okay, good night.
Good
Yes,
night.
sir.
Good night, sir. Thank you, sir. Thank you, everyone. Thank you for the patient hearing.
Dr. SUMANA KUMARI PANDA will be presenting another session two part. It will have 2 part on January 21st and 23rd with a different remedy. Thank you, Dr. for such a beautiful presentation and those who attend the session. Tomorrow we will have a session from Dr. Suraj Bahadia, and he will be talking about challenges in homeopathic pharmacy. With that, we come to the end of the day, 1,508. Thank you all. Good night.
Thank you. Good night.
Over to Dr. P. Shaila to moderate the Malayalam session.
I'm leaving. I can't follow Malayalam.
Okay, madam.
Okay, thank you, thank you,
Thank
madam.
you. Thank you. Thank you.
Thank you, Dr.
Bye.
Dhanesh.
Goodbye. Good night. Good night.
Good night.
എല്ലാവർക്കും നമസ്കാരം.